At Washington Hospital, there's an extraordinary level of very personal care.
I had an AVM and it just ruptured. They told me that it's less than 1% chance for this to happen to anyone.
If we'd had to wait for another neurosurgeon to become available, I don't think I would have made it.
I was in ICU for like 2 weeks, and I have absolutely no complaints. Everybody here was amazing.
Well, one of the things that's unique about Washington Hospital is that we're a district hospital. We have all the same treatments and expertise that some of these much larger institutions have. I take care of patients in the ICU primarily who have injuries to their brain, most often from strokes. Stroke, in fact, is the leading cause of adult disability in the United States still today. It's been estimated that we lose about 2 million brain cells for every minute that goes by between the stroke that's been identified and its effective treatment. So every minute, every second counts in terms of getting people that are experiencing a stroke to medical attention.
Hi, Ms. Machado. How are you today? Good. Neuro Interventional Radiology is a kind of radiological discipline that really evolved as the natural product of computer technology evolving and also certain intravascular devices that are minimally invasive. These specialized devices are delivered usually from a remote location. Your route of access is usually a tiny incision in the leg. And from there, the tiny microcatheter or wire is navigated through the abdomen, through the chest, through the neck, into the patient's head, and then into the brain. The blood vessel that is diseased in the brain is then selected and manipulated. It's super remarkable. In fact, the ability to treat something as dangerous as a cerebral aneurysm from a tiny incision about the size of your eyelash in the leg is dramatic. The quintessential cerebrovascular case is a ruptured cerebral aneurysm, and those do not happen every day. Usually when they happen, they're at remote hospitals and they have to be brought in to a major center that does this kind of specialized surgery.
I was just in my room watching TV, and I got up to grab something to drink, and I just felt my neck get really stiff for some reason.
I was at the beach with my best friend. We took our dogs to the beach because it was like 80 degrees out. The dogs were getting hot, so we decided to go, and I was the one driving. And I just got a major headache.
I was scared, and it was kind of hazy because my brain was in a lot of pain.
I just felt like a sudden headache, like a really strong headache.
And right when that happened, I just passed out.
It wasn't until my uncle, my sister, and my mom convinced me to go to the ER. Because I honestly didn't want to.
The firemen actually came, the paramedics, and I wasn't responding. I wasn't alive at that point, and they did CPR and everything, and I came back to life. And then they ended up just flying me out to the Washington Hospital here. And
when we actually got here, the attention that I received, it was immediate.
The one thing I do remember very, very clearly is how quickly everything moved and how efficiently, and that I kind of felt like I was the only person in the room.
My diagnosis, I had an AVM and it just ruptured.
They said I was having an aneurysm.
They told me that I had an aneurysm and that it required surgery.
They would try to coil the aneurysm through the cath lab. I think he told my husband it would be about 2 hours, and about 4 hours later, he came out and told my husband that it wasn't working and that we'd have to go into the OR and do an open brain surgery.
They told me that it's very slim chance that I'm gonna survive, and then if I do survive, that I'm not going to be 100%.
If Dr. Thomas hadn't been licensed in both practices, we might have had to wait for an open brain surgeon to come, and I probably wouldn't have made it.
Dr. Thomas and Dr. Rose were going to do what they could do, and once they finished the procedure, then it was up to me after that.
I don't know if I would have ended up going to another hospital if the results would have been the same.
I'm so thankful that Dr. Thomas put his all into the procedure for me.
He had told my husband that it was a difficult one, but I woke up a few days later and here I am.
Mr. Munoz. Great to see you.
You know, I was expecting to have some kind of side effects, you know, some deficits, but no, you know, everything turned out well. I feel 100% now.
How are you?
I'm good, how are you?
You look fantastic.
Thank you. He's like my angel, you know what I mean? I'm here today because of him.
There's some kind of a relationship that forms when somebody saves your life. And it's really profound when somebody has been in your brain. I can't explain it. So I am attached to Dr. Thomas in a way that I'm not attached to any other person.
Having that patient come back and see us in the office, living the most happy and fulfilling life that they can, despite having gone through such a life-changing and life-threatening illness, that's most gratifying.
Learn more about stroke treatment and prevention at BayAreaHealthierTogether.com.